So we're talking about cardiac output. So my cardiac output equals my heart rate times my stroke volume. So let's say my heart's beating 70 times a minute and each stroke volume is 70 milliliters, right? And we talked about stroke volume being the difference between my end diastolic volume when the heart's the most filled at the end of diastole, when the heart's the least filled at the end of systole, my end systolic volume. So this difference between the two, that's my stroke volume, okay? So those are my two factors that are directly affecting cardiac output in this equation. So we'll just go over this first. So for 4,900 milliliters a minute. Now, can this change? Well, we talk about this in the textbook. This is a rest. What if your patient starts exercising? So let's say their cardiac output, let's say it changes. Well, what can happen? We have two factors here. We have heart rate we can affect, and we've got stroke volume that we can affect. Okay, so let's say our heart rate goes up to 140 beats per minute. So say 140 beats per minute. And these are just numbers I'm just pulling out of the air here. And let's say our stroke volume, let's say it goes up as high as, let's say, 100 milliliters, right, which is really high. So we could actually do that, right? So this would equal, well, if you take 140 times 100, well, this is going to increase our cardiac output to 14,000 milliliters a minute, okay? So my heart rate doubled, my stroke volume went up by almost 50%, and you can see I almost tripled my cardiac output. So I went from about 5 liters a minute to 14 liters a minute, right? Because 14,000 milliliters, we can just say this is 14 liters a minute, right? And this could be roughly, we'll just say 4.9 liters a minute. Okay, so the two things we can change are exercising, right? Or any kind of sympathetic outflow is going to make the heart beat faster and harder. It's going to increase our cardiac output, okay? And stroke volume, obviously, we'll look at that when